Okay, let's get to our presenters today. Our first guest ensures that NLI follows the cutting edge neuroscience in our frameworks, perspectives, and solutions. NLI Senior Director of Neuroscience Research, Dr. Kamila Sip. We call her Cami. Hi, Cami, good to have you.
Hi, Gabe. Great pleasure to be here with everyone.
Excellent. And we are very pleased to welcome a close friend of the firm who has a passion for creating meaningful employee experiences rooted in inclusion, humanity, empathy, and strengths-based growth and development. She is the AVP of Human Resources at Pure Insurance, Swati Goel-Patel. Hello, Swati. So glad you could be with us today.
Hi, Gabe, and hi, everyone. Thank you so much for having me. I'm really honored to be here and looking forward to our dialogue today and learning from our participants' questions and insights.
We're very happy to have you. And kicking us off, our Director of Industry Research, who has been instrumental in bringing insight to talent management practices of companies around the world. You may recognize her work from a number of our webinars and white papers on growth mindset, Andrea Derler. Hi, Andrea. Thanks for joining us today.
Hello, everyone.
And with that, I'm going to hand it off to you, Andrea, to get us started.
Got it. Thank you, Gabe, for the wonderful introduction. And I also want to say hello and welcome everybody on the line today. It is wonderful to be here with you. Thank you for joining us. We are well aware, of course, that the US had a very big day today with a new president just being sworn in. I say that because all the more we want to thank you for deciding to join us for the next hour to discuss our research and to listen to Kami and to Swati today. Now, you are in for a special treat. You will hear about our newest industry research, which is science-based industry research, and we'll hear a practitioner's story. How does this research actually come to life? So I'm really excited to guide you through that today. Now, what are you going to learn today in the next about 45 to 50 minutes? We did this research last year between May and June, so we're going to share with you top findings of the research about what were the psychological impact on employees during the 2020 to 21 now pandemic. Because of course, like so many others, we did study the pandemic, the COVID-19 pandemic. So what were those psychological impacts? We also would like to share with you now, how can leaders actually preserve employees' optimism about the company's future? We made a couple of really interesting findings in that regard. And the third point is, what can organizations do to actually keep employees engaged through tough times? All of that based on science, and Kami will guide us through a lot of interesting research there. Now, let's set some context for what happened actually since last March. Now, who doesn't actually remember, which is shown on the next slide, and when long before the pandemic, maybe you remember when Professor Robert E. Kelly kept his cool during an interview about South Korean politics when his two children interrupted him live on air on BBC World News. It was a precious moment. What we didn't know at the time is that this was going to be a preview of what's to come for probably hundreds of thousands, maybe millions of employees, office workers who would soon be working from home with a family in the same space with pets and other family members to care for. And so it is really, it was an interesting moment for us to say, well, who knew that we all going to be, or many of us are going to be in that same position. So what we did at the time then at NLI as a research team, we studied the impact of this pandemic on the workforce, again, in the first wave between May and June last year. And so we're going to share some of the data with you. The first, probably most well-known and expected data point is that there were the three top ways in which employees were most affected by what was happening at the time. Of course, the first one, the most important impact was the intensification of remote work, which for many wasn't a big change in itself. For others, it was a huge change. The second was many experienced a loss of revenue and profits in their organizations with all the implications that come with it. And the third big impact was actually, surprisingly, the change to, or again, an intensification of virtual learning. And so depending on people's industries, of course, and on their roles and their geographies and regions, remote work was more or less the biggest shift, as people were unable to go back to the office and really had to learn how to be productive from their kitchen tables. Now, this comes to our first poll. We really like to hear from you. This is a very interactive session, as Gabe indicated. We do want to hear from you. We have a poll for you at this point, which is, What was the biggest impact of that COVID-19 pandemic on your workforce? Was it remote work? Was it a loss of revenue? Was it virtual learning? Was it something else? So really curious to hear from you. Thank you for participating in the poll. And whilst we're waiting for those numbers to come in, I have a question for Swati, if I may. Can you talk a little bit about how has the pandemic affected employees at Pure Insurance?
Yeah, absolutely. So at Pure Insurance, we were really fortunate. Our business model proved to be really resilient, and we were able to pivot to work from home pretty seamlessly with technology and equipment. But from a people and human-centric standpoint, we really understood that we needed to meet people where they were in life. Each person's reaction to COVID-19 was so different. And you see, in many ways, COVID was this great equalizer. We were experiencing this collective suffering and pain together, and the line between work and life became blurrier. Although I like to say it's really just one life, and that's much, much truer now. And yet, our individual reaction to the pandemic was extremely personal, and we really had to address each employee with care, empathy, and understanding. So we encourage managers to have more honest conversations with employees and really share their vulnerability as leaders. See, when managers are able to talk to their teams and employees about the fact that they might be struggling as well, it really opens up the space for employees to also share what they may be going through. So we did this in a couple of ways. We adjusted our check-in framework to focus on connecting as people, shifting goals, shifting schedules, building new habits, redefining connection and relationships, and also a focus on recharging and prioritizing self-care. So we provided a guide of questions, including things like, do you have the resources you need? How are you managing childcare or elder care? What's your daily routine now compared to what it was? What are the best working hours for you? How can we stay connected? Now let's take all of that and put it into context of realistic goals and shifting work. So we really looked at it as a whole person approach.
Well, thank you for that, Swati. And I'm sure we learned a little bit more about the details of these initiatives that you ran there in the course of this webinar. I just wanted to also say thank you for the audience members who have participated in the poll. You have basically confirmed a lot of our findings. Remote work did indeed was the biggest impact of the pandemic on your workforce as well. Thank you very much. I also want to read some of the comments. And thank you also for those of you who have put in comments here. So I see that other effects was the fear and the uncertainty of COVID, what's going to happen, stress coming off of that, also mental health issues for employees. Mental health, people feeling isolated, people feeling uncertain about the futures, parents feeling extremely burdened by the increased demands, something that I know that many of us have struggled with. So thank you very much for all of you who have put your comments into the chat window as well. I think it's great for all of us to read through those. Now, Kami, we've also, of course, studied the impact on people's psychology from a science perspective. What have we learned about the psychological impact on our end?
Thank you so much, Andrea. And I'm also looking at the comments, which go quite along with everything that we've learned. I think the anxiety and the mental health impact, our mental state that was impacted, especially in the first wave or the first shock that we used to call it the shock of the pandemic. The first few months were very much like a triage in a healthcare situation for healthcare employees and the essential workers, but also for those who suddenly overnight had to switch to working from home with parents and kids and pets and in-laws, everybody gathering in the same space. And obviously that shifted quite a lot or increased the level of anxiety that we were feeling, because everything went just upended in a basically overnight situation. So that was contributing not only to the really increased anxiety levels, but also the quite significantly diminished ability for us to focus on the things that we normally would be able to focus, like collaboration, problem solving, and carrying on with the normal tasks. And I think that in many ways, we tend to forget about the immediate impact that we had and what was the type of stages or the type of response we actually were having to that really unprecedented change to our life. And Gabe, if you don't mind going to the next slide, what we were discussing, especially at the beginning when we were looking at what happens to us, and to make sense and to give others the language so everybody can actually maybe label where they are coming from, or what stage or what level of anxiety and threat response they were at. We actually noticed that we've been experiencing three different levels of threat that were fluctuating every day for all of us. Especially initially, we were all at level 2 threat state, which essentially means highly alert and somehow alarmed. Level 1 would be the threat state that is alert. So you are becoming alert, but not really alarmed with the situation that is around us. And then level 3 state would be the panicking almost stage, the state that is not productive to do anything else outside of just taking care of the survival that we were at. And when you go back in your mind and think about the time between March and June, that was the almost the epicenter. That was the biggest wave and the massive change. And it was very challenging for us to be at level 1 threat state. Means that we were going back level 2, maybe 1, 2, 3, 2, 2, 3, and we're fluctuating depending on what was happening in the news, what was happening in the organization, what was happening in our private lives. We're going up and down, which, even though we've done this research and we are reporting between May and June, the mental impact and the psychological impact of that was carrying over. And we've actually have seen massive changes in hundreds percentages, increases in depression, in anxiety, and everything that is related to our mental state in many ways. And somebody mentioned uncertainty, and this is one of the main reasons that we felt this massive amount of anxiety and distress, is because everything went up in the air basically overnight for us, from us not being able to predict whether we are actually having a job, whether we are going to get furloughed, whether we are there's going to be multiple waves of layoffs, how long is the pandemic going to last, am I going to be safe? So the range of uncertainty that suddenly unfolded in front of us was really overwhelming. And in many ways, when we think about uncertainty, we tend to think that we actually confuse familiarity of the things that we experience with certainty. But we know that psychologically and from neuroscience that nothing is really, we deal with uncertainty all the time, but because suddenly there was so many things happening at the same time, it felt like everything was uncertain and we couldn't predict, we couldn't essentially make patterns for our brain. And Gabe, if you don't mind going to the next slide, this is basically what was happening to us, the uncertainty and the link to anxiety. The more uncertainty, the more anxiety we were having. And it all coming back to our primary needs, which is the need of survival, basically. And Swati and then I will be also discussing that a little bit more with connection to the Maslow need. Like, if our need for survival, the basic physiological needs and psychological needs are not met, it's going to be very challenging for us to be able to be productive and collaborative and have a lot of perspective taking and understand what others are coming from, when in our mind and our brain thinks that we are fighting for survival. And ironically, a lot of the times that's not the case for us in reality. There is no real threat and we are still fighting for that survival. But in the case of pandemic, there was actually a very real threat to our life, to our livelihood, to the organizational stability. So there was a ton that we didn't know how to handle, and it was having a massive impact, and it still carries on, especially when we think about knowledge workers versus production workers versus healthcare workers, those who didn't have the remote option of working. The amount of stress and mental baggage that this pandemic is going to project for years to come is going to be something that organizations need to still grapple with and think about how to manage that, because we are not out of the woods when it comes to anxiety and mental impacts. Yeah.
Thank you, Cami. A lot of the things you've addressed, I think, almost are reflected in our chat. Thank you again for all the audience members who have put their comments in, because there's such a diversity of experiences in the impact of how it was perceived and what happened to them, which is actually the content of our next data point we wanted to share and hear from Swati again. We wanted to understand, was that felt anxiety level different or almost the same across certain populations, for example? Does the situation affect us all alike? And so we'd like to ask you again, if you would like to take part in this next survey, which is, compared to your peers, did you feel more or less impacted by the pandemic? Really curious to hear and to see what comes out of the questions. We're going to have the poll run again. I'd like to hear, and if I may ask you, Swati, have you seen any differences in the ways in which people have been affected by the pandemic at all?
Yes, absolutely. So as I said earlier, COVID-19 really was this great equalizer in many ways. However, so many different parts of our population experienced it so differently. So we discovered that many of them, were very motivated, very high achieving, and they were struggling. So for parents, reaching any sort of pre-COVID productivity was nearly impossible as daycares closed and schools moved to remote learning.
Yeah.
And despite many communications from leadership offering support, employees, especially those who are parents or caregivers, really needed to hear from their managers that they had permission to adjust. And we really worked through each unique situation with every employee and partnered to find individualized situations, because not every situation was the same and we didn't want to treat it that way. And in terms of hiring, we were very fortunate. We continued to hire people, and we continued to hire employees at the early career level and also experienced talent level. So we had to be very thoughtful of virtual onboarding and training. We know that a comprehensive introduction and onboarding to any company's purpose, principles, and culture is really important. And we were very protective and wanted to preserve that experience. We ran what normally is a 6-week analyst program in person. We ran that virtually, as well as many of our multiple, very other signature training programs that we run at Pure. And we learned a lot along the way, right? And although our virtual programs did run better than expected, it was clear that people really missed that in-person connection and that social connection that you have when you're together. That just could not be replaced. And I would say that we are very grateful to report that Pure Insurance had 0 employee deaths due to COVID, but many of our employees' friends and family networks were not spared. Right. And so there is and was much, much grief, and everyone experienced some sort of loss, even if it was milestones or traditions or connections. So we did provide mental health services to our employees, and we did that before COVID as well, but definitely noticed that the utilization increased during this time.
Oh. It's great that you mentioned onboarding. We get to the responses in a minute because this is a big topic, but thank you again to our audience. Let's look at the poll data. The majority, 40%, were close to the same, said, well, my peers were actually more impacted. Of course, there are members of the healthcare industry who said, well, I was really impacted probably more than others because I work in healthcare. So thank you, Regina. I see that comment there. Overall, it seems that the perception was that other people had it worse, or at least the same. I see this pattern when we ask this question on webinars, it's always the same. So thank you for all of you for responding to that. I also want to mention that there was one comment about the onboarding. Beth mentions in her comment that the stress is real for some employees that are hired through virtual interviews and are really trying to virtually integrate into a new culture. So I think similar to what you've mentioned, that it was a big focus for you to really be able to integrate employees virtually into a culture. Like, where's that culture happening, right? It is now happening online. So really interesting commentary there. And thank you again for taking part in the poll. Now, we actually studied that we coincidentally found in our analysis that anxiety levels actually were not felt the same across all our survey participants. Again, this is based on 688 survey participants across industries and hierarchy levels. We found statistically statistically significant differences in the way people were reporting their anxiety levels. If you see here on the left, the orange, people who experienced childcare management issues, who were affected by COVID-19 infections in some way themselves or family members, or who experienced reductions and furloughs in their companies, had significantly higher anxiety levels or reported them versus those who were affected and experienced the impact of the pandemic differently. Yes, of course, health and safety issues are always a concern, but it didn't cause or wasn't correlated to high anxiety levels. It did cause some anxiety levels, but not as much as for the other group. Negative impact on revenue and profits, and no or less business travel. Again, those indicators here, these were people who experienced those, had those experiences about the pandemic. Again, significantly different anxiety levels. I think that's just interesting for all of us to understand that experiences are not the same of this pandemic, and lots of implications for leadership here and managing teams, etc. Now, let's move on to the next big section of this discussion today. We, of course, wanted to understand a little bit more about what are employees' psychological needs? So we know how the pandemic affected people, but what do they actually need in that time of crisis? In other words, in addition to feeling anxious already or having more difficulty focusing, for example, was there anything that they needed that was more pronounced than other things due to the pandemic? So I actually would like to start with you, Swati, if I may. I'm curious, how did you at Peer Insurance tackle employees' needs during that crisis, like psychological needs?
Yeah, so from our team's interest in work in psychology, you may notice, as Cami mentioned earlier, Maslow's hierarchy of needs here, and all of our work with NLI around neuroscience, we knew we needed to tend to people's psychological needs first, beginning with safety and security. So we reassured everyone that their job was secure and that they could perform them remotely. You will not be productive if you are worried about your job and also how you're going to get toilet paper, right? It was really, there was basic essential needs that needed to be met at that time. Mm-hmm. And you can see a few things that we did here at the organizational level that I'll talk through. So the first thing we did is we communicated regularly and really began to view this opportunity to advance community and belonging, even though we knew we physically could not be together. Our CEO held weekly town halls, which was up from a monthly cadence. And every morning from mid-March to July, our HR team, along with many other partners in the firm, sent a company-wide email with positive guidance on topics ranging from building resilience, gratitude, understanding one's strengths, to more practical support like staying focused and attending to wellness. It was a really big endeavor, and I think we sent over 90 emails, but it was so well received and really made people feel like we were in it together. We also included pictures of executive members with their kids, employees volunteering, pet adoption stories. There was a lot of that happening during the pandemic, stories of our frontline heroes. And so employees who had family and friends on the front lines. I know my husband's an emergency room physician, so during that time, there was an extra added level of stress for us. We also had some fun. We talked about what we're binging, what are some Netflix recommendations. And so we really tried to make the experience normal for a pandemic. And we also did some other things. We partnered with Headspace. We have a partnership with them. And as you know, they're the meditation and well-being app. We hosted company-wide meditation hours throughout the pandemic. We also built a weekly calendar of virtual wellness classes. And some of them, we even used employees' own passions. And so we have an employee who has a certification in yoga, and she continues to lead weekly yoga sessions for our employees. One of my favorite programs is we launched a program called Coworker Coffee, in which employees get randomly matched with a different coworker every 2 weeks, just for a casual conversation. We've had over 3,000 pairings of this program. Wow. And it's really helped meet colleagues. It's really helped people meet colleagues they would have never crossed paths with previously, and really helped build some relatedness, which I know we'll talk about in a few minutes. And then we also created parent support groups. We use Microsoft Teams, and they allow you to build different channels in there. And we organize channels by child's age, really to give working parents a place to talk through challenges, share ideas, tips, frustrations, because let's be honest, we certainly had those, but also joys and resources. Many of us, especially parents, have really found great silver linings in having this time with our children. I know I have. I know this is time that I'm not going to get back, and I've very much cherished it. We also have a couple partnerships with Bright Horizons and Life Meets Work, which also provides professional one-on-one counseling service for parents and caregivers. And the last thing I'll mention, I know I've said a lot, is, from virtual happy hours to baby showers to bridal showers to virtual Kahoot parties and Pictionary, the community and connection that our teams built during COVID has really been remarkable. We've taken a situation which could have caused a lot of disconnection to a situation where it caused a lot of emotional connection. So really proud of that.
Rightly so, Swati. Thank you for talking us through that. What we haven't shared yet is why, of course, these are the reasons why we have featured Pure Insurance in our report, because it's an outstanding example, not in terms of the diversity, not only in terms of the diversity of approaches and initiatives that you helped organize, but also because it helped address so many of those psychological needs that Kamila will talk us through now. So thank you for presenting that. And as just wanted to encourage our audience, as you're listening now to, as Kamila is talking us through some of the science of psychological needs, if you think back at what Swati just shared, they really did the right thing for employees in that time of crisis last year. So I'd like to ask you, Kamila, how have we at NLI approached that topic of people's needs during the pandemic's first wave? What is our approach and how does it fit with Swati's story?
Yes, sorry. Thank you so much, Swati. And everything that you've mentioned, actually, it's falling really nicely under a lot of relatedness and certainty that you provided to your employees. And the relatedness aspect and community building, it was the one thing that we were missing probably the most suddenly overnight, that everything felt like it was lost. So to kind of double down on all of the initiatives that you've carried out is actually fantastic to hear that. At NLI, we looked at the psychological needs from the perspective of our SCARF model. So we are looking at this. Probably majority of you who are joining us today know our SCARF model is essentially a 5-domain model that talks about the 5 domains that we all need when it comes to meeting our psychological needs. So from our needs for status, for certainty, autonomy, relatedness, and fairness, we all as human beings have actually all 5 domains, and they differ depending on the situation and our natural preferences and our natural needs for different aspects of those needs to be met, for us to feel engaged, for us to feel like we belong, like we actually feel included in the organization. And when we look at what I mentioned earlier, that Maslow always wins, basically that when you think about the basic human needs that are met, and then we looked at the psychological needs within the cultural organization, meaning what is that organizations can do, what employees need the most across the 5 domains of SCARF. What we actually found out is that it wasn't all 5 that was spread out evenly across the population when we ran our surveys. It's actually 3 of them that came to be the forefront runner in the midst of the first wave or the first stage of the pandemic, meaning the triage, the pieces when we needed the most survival based assurances. And if you go Gabe to the next slide, we can actually see that the 3 main drivers that help employees feel more confident about their position and their security in the organization, but also in the confidence in the organization surviving, and in the fact that the organization is actually taking care of them in the midst of the pandemic, was certainty, fairness, and relatedness. And what it all means is essentially, if organizations, the questions that the employees needed the most answers to was, what is that we are going to do? Are there clear rules? Can you provide me with any information that I don't normally have that can help me with some level of clarity or some level of certainty that is otherwise completely disturbed? Fairness is another really, really potent need that we have, especially in a crisis, or especially if there are a lot of moving parts, because that's the type of need that it all goes back to our perception of fair distribution of resources and information, but also about transparency. And this is something that Andrea will be mentioning in a little bit, that when it comes to transparency, the moment we don't feel like something is fair, and it doesn't need to be equal 50-50. It's more about equitable distribution or transparency of decisions that we otherwise don't necessarily have the insight into, meaning what's happening, why was the decision made. That can trigger a lot of distress for us when that need is not met. And the third need that was the one of the most prominent one, which was actually what Swati and Pure was tending to the most, which is the relatedness. And when you think about what we as human beings need the most is to belong, to feel like we are part of the group, to feel like we have security and some longevity with other people that actually can be part of our support group. And ironically, the one thing that we needed the most in the pandemic was a hug, was to go out with somebody, to get coffee, to physically be with somebody else. And that was literally taken away from us. And by losing that physicality and the physical ability to be with other people, we actually needed to replace a lot. And Pure has done it really, really well with combining all of those things and simulating and augmenting that experience in ways that was not necessarily met otherwise because of the function that we couldn't do in the context. And the one thing that we found out was actually that whenever there was a team cohesion and people feel like they belong to a group or they have a place in the organization, that was the one domain that was actually decreasing the anxiety when it comes to actually understanding and moving the psychological needs, shifting some of the psychological distress that they would have otherwise. So that's a sign that also it still carries on. It's still something that organizations would need to pay attention to make sure that inclusion, and especially after the social unrest that we've experienced, which compounded with the pandemic, it kind of shifted a lot of the challenges that we would be facing otherwise with the pandemic to completely different level for so many of us. And I think it's quite important to link it back and think about what is that we need right now as we come out to the different stages of the pandemic, without forgetting the core needs that we will have across the board as we go through it, even in the recovery and now with vaccinations, etc.
Mm-hmm. Thank you, Kami. So a beautiful reflection of some of the scientific findings in Swati's or Pure Insurance's example here. I wanted to come to some of the audience questions here. There was a lot of energy in the chat around the coworker coffee connections. And thank you, Swati, you've already responded to like the logistics of how you did that. I wanted to ask you a question that is quite interesting from Jackie, who wonders if any workers were reluctant to engage in the events and connection activities provided. Did you see that at all? And how did you deal with that?
So none of these programs were mandated, right? They were all different options for people who might be comfortable to sign up to them. So what we did encourage is managers check in with every employee, right? Regardless about whether or not they were interested in connecting with a company-wide or organizational level program, it still was extremely important for managers to connect individually with every single employee. And as we started speaking more about these programs at a high level, whether it was in town halls or whether it was in daily emails, there became some excitement around it, and it built some momentum. And I think you saw employees who would previously be reluctant to do so take a chance because they saw other people were doing it. So when I say we've had 3,000 pairings, that's not every employee. We've had probably 250 to 300 employees sign up, but the different permutations and connections we've made as we've manually paired people up over the couple of weeks has resulted in thousands of pairings. And I see that there's a lot of interest around coworker coffee. Mm-hmm. There is no program that we use to match. There are a group of people much smarter and better in Excel than I am that do this. And interestingly enough, the coworker coffee program was not designed by our HR team. It was an employee idea that with our support was just brought to life. And so, again, just a little bit of time, a little bit of creativity. Some of these things don't cost any money. But Andrea, to your earlier point, we didn't force anyone to join a program that they may be uncomfortable with, because not everyone has that comfort level in being social in that way. But, again, we want to make sure we were connecting with every employee. So even if it was that was done on a manager, peer-to-peer or team level, that was fine too.
Thank you for clarifying that. I think that's, again, we see a really diverse reaction to the pandemic and the experiences of the pandemic, and also all different needs and also what people really like. Some like to go to coffee meetings and team online coffee meetings, and some don't. And I think it's great that you had not had that mandated, because it may not be that person's need. So thank you for your answer there.
Andrea,
Now,
do you mind if I add a point? I think that that's a really important point to make. Also, the fact about non-mandating things and not expecting that create a program that is a blanket statement for everyone. That goes back to our natural way of thinking, that I want to, we should be treating people the way you want to be treated. And it's a little bit of a misguided assumptions, because what we actually should be, what we know from science, is that we should treat people the way they want to be treated. And this is when organizations can actually offer things, but not expect that it's going to be the same level of engagement across the boards, and actually allow people to say, no, I don't need coffee because I don't have, as somebody mentioned, I don't have a private space and in which I can just chit chat, or that hour can actually take away from my time with my kids without being on Zoom. So I think that's a really important for organizations and individuals to don't go with what works for us, but if we want to offer somebody else's comfort, it would be, what is that would work for you? What is that you need that we can provide? So that's
exactly.
That's great. Yeah. The golden rule, right, does not apply actually anymore. They used to say that. Dave also said in the chat, yes, allow people the autonomy that they also need. And Kamila, you've mentioned autonomy as one of the needs in the SCARF model. So it all comes together in an interesting way here. So thank you for all your comments there.
And one thing I think that about autonomy, Andrea, when we think about the first three needs that we had in the acute stage of the pandemic, what we are observing right now is that when we got used to some of this uncertainty and actually kind of succumb to the realization that, okay, it's going to last way more than 3 months, we are looking at much longer timeline. What employees actually need right now a lot is the autonomy, is actually giving them some level or much more control over what happens, how they work, where they work, when they work, to kind of counterbalance all the changes that we had to accommodate otherwise. So I think that it's important to also know that those needs will change as the context changes, and organizations need to also allow for that. Yeah.
That's a very important comment. Yes, it's not going to be always the same. So thank you for adding that. Yeah. We have another poll for our audience. We'd like to ask you, as you're reflecting about your own organization's response to the crisis, do you think that your organization's response met or meets your psychological needs? Quite simple answer options here. Yes, overall it does. No, not really. Or maybe you have never really thought about it, and that's fine too. Please do participate in the poll, and I'm really curious to see what the outcome is. Currently, people do say yes. We've had overall favorable assessments of organizational responses. Remember, Kami, we had this data point about 77% of our survey responses did say yes. Overall, the response measures taken were reasonable. Whilst we're waiting, Dave has a question. Kami, can you take that? Can you please talk about what you see is going to happen next? Can you anticipate, you talked about autonomy. Is there anything that you can share about how leaders can prepare for continuing uncertainty? Any special tricks there from a scientific perspective as you're waiting for the poll to close?
Yes, thank you. Special tricks. I think that I did not call it that way.
Forgive me.
No. I think that we all would need some special tricks for sure to move on from this state. But I think that it's a really good question. What we are noticing right now is that there is a lot of reconsideration of what the new hybrid work would look like right now, that with vaccination and everything that is, it feels like on one hand, we're seeing the light in the tunnel, but on the other hand, is not that the light is not as close as we would like it to be. So we are looking at a solid another year, realistically, of quite a lot of changes, both psychologically to organizations, to how we work. And I think what I am working right now specifically is trying to figure out what are the best practices for organizations, for HR leaders, for HR professionals and leaders to work together in terms of how to enable the hybrid work in a way that is productive for all types of workers, from knowledge workers to production workers, to healthcare workers, because as we come back, it's not the same blanket solution that can be achieved right now, or it has never been. The other component is that there is a fatigue, there is a rebellion that is growing in us. We kind of feel psychologically like, oh, when is this going to end? We thought that 2021 is going to be a magical year from day one, and it hasn't proven to be the case just yet. So there's psychological distress that is right now turning, somebody mentioned anger and frustration and exhaustion. Organizations would need to deal and take care of burnout, because we've been putting so much more resources to try to compensate for the different type of working right now in a somehow forced hybrid work or somehow forced remote work, but it's coming at a cost to a lot. And I think that the burnout would be probably the next really important thing to take care of. And the way to do that, there are different ways and different approaches that we can actually start thinking about, from actually going back to the basis and seeing what the population actually needs, what would be the best way to change that. And we are going to actually talk about it right now when it comes to power, the disconnect sometimes that the top leadership can have with the direct reports or with everybody else in the organizations, because the vantage point is different. So it's important for leaders to actually shift perspective and ask for what is that is needed, what would be the most beneficial way for to organize, whether it's work or processes or procedures or performance reviews. All of those components actually are shifting right now and need to rethink. But it's shifting the paradigm. I'm not sure if I answered David's
Lots
question.
to discuss. I'm sure you did. That is the big next topic. So thank you for responding to that. I wanted to move us along to the next question, not before thanking the audience again. So we have 60% say yes, overall the organization does meet the needs, but again, a third of you say not really. That is quite significant. So thank you for sharing your opinion there. Now let's move to the next section, because we promised to say to also talk about what can organizations do now, even if we, Kami, you just reminded us the pandemic will not last forever, but it's also not over yet. So in this last section, we studied also what is it that organizations did that really instilled confidence and optimism in employees, even in that first wave. And so we'll come to that, but before that, we also wanted to perhaps present to you a couple of gaps. So what did organizations not do really well, just to make it a bit more interesting? I'm going to move us quickly through those. The first gap, as we call it, during that pandemic, was transparency in decision-making. That's an interesting one. Kami mentioned that we need this in order to feel treated fairly. Only 37% of our survey population said, well, the decision-making in my organization was transparent. And what's even more interesting is that top leaders, and we could dissect the sample a little bit, gave much higher ratings on the level of perceived transparency than all others, such as middle managers and first-level leaders, which means that there may be a different perspective, a little bit of a disconnect between what top leaders perceive. Perhaps they may think the organization is transparent, but it's not perceived like that on the other end. So transparency decision-making, really interesting topic that we'll dig a little deeper into in our further research. The second big gap that we identified was about leader role modeling, an evergreen in leadership development and leadership theory, probably 100 years old, probably much older. Only 50% of employees said in our survey that their leaders are role modeling the behaviors, the new behaviors that were asked of them during that difficult phase of that first wave last year, so during the pandemic. So lots to digest and dissect on that topic. Just wanted to throw this data point at you as we then investigate what's actually really important to maintain confidence. The third gap is around clarity. And we found that 60%, again, you may say that's the majority. Yes, but what about the other 40? only 60% or 60% of employees in our survey did say that they have a clear understanding of what to do, how to support their organization in this time of crisis. So this is around clarity. What can I do to support my company? That's not always clear for people. So quite an interesting collection of gaps here. We'll come to the resolution of this, what actually does drive confidence and optimism. But I wanted to throw this question at Kami first. You know, as you're looking at those gaps, and just in a couple of minutes, very shortly, how can you explain some of these shortcomings that the research identified?
Yes, absolutely, and that was something that we mentioned earlier. That a lot of those gaps are coming from the different perceptions and the different vantage points that leaders and direct reports and managers have, because we are coming from perspective of very different access to information. And as you go up in the hierarchical ladder and positional ladder, your power technically grows, but that also comes at the cost of having those three cognitive effects of power, which essentially means that we are becoming much more goal oriented and goal focused rather than people focused, which means that we are also going to be much more confident in terms of the timelines and things that needs to be taken care of, and see much less of the obstacles. And lastly, concentrating on the vision also means that we are losing the detail. So when you think about the metaphor of a mountain, if a leader looks from the top of the mountain down, you don't necessarily see all the gaps, all the nuances that somebody needs to go through to get to that top. However, if you in the position of standing below at the bottom of the mountain and you looking up, what you actually see is the opposite. You're seeing all the things when you would need to pivot to execute on a task, to be able to get to some level of resolution. And that level of disconnect, it's really, as I was mentioning earlier, is the one of the core issue that is causing this gap in transparency or gap in clarity, because what we think looking from the top down, what we share is sufficient amount of information, and that we are transparent may actually not be the same, because our positions and the vantage point is very different to begin with. And one of the questions, Andrea, I wanted to answer here that popped up about what managers can do and how to manage this uncertainty, prolonged uncertainty, with understanding that leadership has this cognitive effects of power that everybody would be subjected to. Basically, it's not about good or bad person, it's about all of us will actually have that, is that one would be acknowledging that this uncertainty is there, almost like naming the beast and acknowledging that it's there, it's for everyone, is also helping the leaders then to take some of the pressure from them providing all the answers. And the other aspect is to concentrating on the essential, providing and guiding employees with what is the essential that you need to do rather than what is exhaustive, what all the multiple things which will actually lead to burnout. So shifting mindset from exhaustive to essential and concentrating on that with acknowledgement that we are in a difficult time and it's affecting every one of us in different ways, but we are all going in it together. And
yeah, thank you. I mean, that was on the manager level, right? This is very, very important to understand that difference. So thank you for outlining that, and thanks for the question also on the line here. And I also like to outline what we found then on the industry side on a higher level. Gabe, if you could please move us to that last slide before we come to Swati, is, ironically, the things that companies were weakest at are the most important ones. And we don't need to go into detail that described in the report. I'd love for you to read the report where we describe it all, hopefully quite clearly. But transparent decision-making, leader role modeling, and clear objectives, setting that clarity, focusing on the essential. These were the top 3 drivers of outcomes as we defined them in the study. And so that is really interesting that that's what employees need the most. This is what drove their confidence in the organization survival, helped them work more effectively, and found their assessment of the organization to be quite favorable of the response measures taken. So these were our outcomes that we defined. And so that's just some food for thought for organizational leaders to say, are we really aiming to provide the right practices to meet our employees' needs and to keep up the confidence? Now, Swati, I'd love for you to guide us through, you've talked a lot about the great practices that Peer Insurance has provided and is still providing for employees. We know that. Can you talk to us a little bit about how do you know they worked?
Yeah, absolutely. So while anecdotally, we were receiving really positive employee feedback and we were working through each employee situation with care, we wanted to ensure we were pointing in the right direction. And we do use surveys at Pure Insurance as an important measurement tool. And this summer we used a Gallup poll survey. And we really wanted to set out to understand, did we lead with humanity and empathy? Did we offer clear and frequent messages? Did we offer assurance about the strength and of the company and the leadership? And you can see here are some of the measures I pointed out. And these were really the most important to us. And we were really pleased with the outcome. 70% of our employee base filled out the survey, and we scored well, as you can see here, in terms of Gallup's normative data. I will say this though, flexibility was the most important tool in our toolbox. We really empowered managers, employees, and our HR business partners to come up with a plan that worked for each individual case. Yes, it took more time, it took more work, it took some customization, and I want all my HR friends out there to take a deep breath. We did have some guardrails, right? Life is not black and white, and it certainly was not here. We had a lot of gray, and we had to operate in that gray. And this approach really provided great rewards in autonomy, certainty, and fairness. And if I can say one quick thing, going back to the question someone had on how do you prepare managers? At Pure, we have leadership levels that range from junior to senior, and everybody needed guidance on how do I have these conversations with employees. And so our team did provide framework. We provided check-ins both from a guided check-in as well as a system check-in to really walk through some of these questions. And we really encourage managers to ask them, because unless you ask, you don't understand what every person's situation is. And it's hard to empathize with someone if you're not clearly seeing what they're seeing and what they're going through. And so we really did provide as much guidance as we could to managers, whether it was organization-wide through framework and through check-in guidance or individually. So that common language was really important as we guided, really the company through this.
Amazing. So you followed it through even up to the measuring, even during that time of crisis. That is outstanding. And I want to point out again to our audience members, you can read about the Pure Insurance case study in quite some detail in the same report that you can download for free on our website. So it is really worth checking that out. Swati, thank you for guiding us and to give us those wonderful nuggets of practices and measurements. Yes, I think we are here at the end of our presentation, our formal part of the presentation. What you see on the screen now is the QR code if you are on a mobile device for a BISET report that features the industry research, it features the science and what the science says about those findings, and of course features our Pure Insurance case study. Swati, I can't thank you enough for telling us in detail about what you've done, how your employees were affected, what efforts you've taken, not only to create those wonderful initiatives, but also to measure the impact and really get that feedback from employees. It was outstanding, and thank you for joining us today. Also, of course, thank you to Kami. It was always great to be with you online and learn something from you every single time listening to you. So thank you both. And I think I'm going to hand it back to you, Gabe, to close us off properly.
Thank you, Andrea, Swati, Kami. That was such a wonderful presentation, and for your time and your efforts, and for your clarity on how together we'll bring ourselves to the other end of this pandemic from an organizational perspective. Thanks also to the NL team in the background that makes this all seamless.